I'm finding the experience of using iWantGreatCare at the moment very satisfactory. It was very easy to set up. I managed to link all my doctors onto the website very easily. I would like at some stage for the nurses to be able to be linked in so that I can get specific feedback from them. But on the whole, it was a very easy solution for providing my friends and family test, which now comes under the new GMS GP contract. I chose iWantGreatCare to collect patient feedback basically because our local LMC sent us information on the website when the LMC realised that practices had to provide the friends and family test as part of the contract from December. They wanted to try and provide an easy solution for practices to use, and iWantGreatCare was the solution that the LMC recommended that we use. Initially, the clinicians weren't that happy about having to go out and get feedback from the patients because it's just one more thing that they have to remember in a consultation. And I think they sometimes feel a bit embarrassed as patients are walking out to ask them to provide feedback, either through a slip or picking up some information at reception. Which is why I've actually taken it out of the GPs and nurses' hands now, so they don't have to do that. So I now do a search of all consultations on a weekly basis, and I send out a block text message to all the patients that have been in the previous week, requesting their feedback and asking them to log on to the iWantGreatCare website to provide that feedback. And so far that's been very effective. At the moment, no, I've not had any negative feedback or had any feedback relayed back to me by the doctors. The patients have actually seemed to have been fine, and for all the feedback that has been left, I've been very pleased, because I would say 90% of it has been very positive feedback. But it also helps us if it isn't always positive feedback, because then I can see exactly almost at the time how they felt their appointment and their experience in the health centre went. That's a difficult question to answer. I'm hoping it does. I think the clinicians and the feedback for the actual clinicians and the nurses individually, I think it does help them because a lot of it is positive. So it does actually assist them with their well-being and how they're feeling about their consultations and their consultation skills. I think the one friends and family test question isn't particularly useful to me in general practice. I think it might be more beneficial to the acute sector. But as far as feedback generally, asking them more questions and asking for feedback that is free text feedback, that is the sort of feedback that will be far more useful to practices than just the friends and family test question.